Thanks. So, Jason Wallace, I manage our living experience engagement teams across Scotland. I'll tell you a wee bit about what the engagement teams are, and then we'll talk a wee bit about the drug checking that we do within that and some of the results that we've managed to see. So, living experience. So for us, living experience is people who have got direct experience using substances. Quite a lot of the guys and lasses that attend the groups are currently still using substances. Some are accessing medication assisted treatment or some other forms of treatment and support. And we know that for these individuals, they often have very different views in terms of what's a priority to them, as opposed to people who might be stable for a long time or might even be in long-term abstinent recovery. It's dead important that we hear their voices. So, the groups are aimed at providing a safe space for these individuals to come and have their voice heard. And you can see there at the moment we have quite good coverage in terms of the groups for the Scottish borders right up as far as Inverness. And we still have a couple of areas to target. The aim is to have a group in each health board in Scotland. You'll see for there, because some of the health boards are geographically really big, it wouldn't serve just to have one group in it, so some of the health boards have got a couple of groups. At the moment we have over 100 people coming on a weekly basis, and it's dead important to say that because initially when we set this up there was discussions about whether people who are actively using substances would actually be motivated to attend something like this. So you can see there, over 100 coming on a weekly basis. The people that are coming kind of reflect treatment, if you like, 70% males, 30% females. And most of the guys and lasses that are coming have a 10-year plus history of using drugs. So well, we don't really see people that are newly initiated into the drug using scene. It tends to be your older, more experienced drug user that's coming. In terms of the national stuff, we have the national group 3 or 4 times a year, and this is made up of representatives for each of the groups you can see. So they will come along, they set their own agenda, so they will look at what's key to them in their local areas, and then they'll work with some of the rest of my team, Stephen and Kat, who are here today, and they'll look at an agenda for the national group. So the last national group, the 3 key things that were on the agenda for them was MAP prescribing, mental health services and housing and homelessness. And as part of that national group, we've been doing lots of work with the National Collaborative around the Charter for Human Rights, and we'll continue to do that until we have the Charter later in the year, this year, probably December. So we took our first sample via the groups back in June 2022, and you'll see when it comes to the figures, once we started to get groups up and running in different areas, we started to realise that people were actually crying out to have drug checking available to them, because that was another discussion that we had. If you give people an option and support them, would they actually bring a sample to the group and be supported to send that to webinars? And a lot of people said they'll not do it, they'll not give you any of their drugs. But once you actually sat down with people and spoke to them, it's quite small quantities you need for the testing and powder and tablets and stuff. People were more than keen to bring it along, and you'll see that for the whole range of substances. A couple of months ago we started the nitazene testing strip pilot across the groups, and I've got a couple of slides. We'll talk about that, but that's been great. Not just as a pilot for the testing strips, but it's been really good as an engagement tool. It's allowed us to open up a lot deeper conversations with people in terms of the actual street benzos they might be using, heroin, cocaine, that type of thing, and give them a lot more harm reduction information and signpost them to the relevant services. So what will happen with the nitazene testing is, once it's tested, whether it's positive or negative, we'll try and encourage the individual to bring a bit of the powder or the tablet to the group, and we'll support them to get that sent away to Wedino's, just to get that confirmed. We've had a couple of instances where we picked up false positives. So they tested positive with the nitazene strip, and when we sent them away to Wedino's, they returned the results and they were negative for nitazenes. So, but it's good that we picked that up, because we know there is a bit of a discussion about the accuracy of the nitazene strips, and we know there's false positives, false negatives. So when people test, what we encourage them to do is drop one of the team a wee message, or myself, especially if they test positive. We'll follow that up with a wee phone call, just to check in with people, find out what substance did you test, where did you buy it, how much did you pay for it, did you get any if you took it, if you have, what effects have you had, has there been any adverse effects you weren't experiencing and stuff. And it's been really good, because people have been really keen to test substances, and I know that anecdotally some of the tests we've gave have probably went to some people's dealers, which is great as well. So they're actually testing the batch at source, if you like. Once we get the results back for Wedino's, they will be fed back in at local level ADP management groups. Then they will be sent to Radar, Police Scotland for the bulletin, and any local drug trend monitoring groups that we sit in. So since we got the first test, there's been 96 samples in total. As you can see there, most of the samples that people bring along are street benzos, and you'll see in the other slides there's lots of different forms of the street benzos that they bring along. I think one of the things that was quite interesting for the Xanax is people had bought it as Xanax bars, and 5 of them came back with bramazolam in them. There was no Xanax, and that was quite interesting. And we started to see a bit of a variation with these Xanax as well. So initially people were coming to the group in the borders, and they were talking about green hulks and red devils, and it was actually Xanax bars that had just been dyed. So as always with this stuff, that people are marketing it are pretty smart in how they market it to the community. So you can see there with the heroin, 3 heroin samples, 1 came back positive for a nitazene, and 2 we were unable to get test results. And you can see there for that's a wee typo, that isn't results for 21 that we're awaiting. That's just the results for 1. I just noticed that. So this is what it looks like year on year, 22, 23, 24. So 22, relatively slow getting it up and running. We were halfway through the year, managed to convince people to bring along 20 odd samples. Most of them being street benzos bought as street Valium, and you can see almost all of them returned, the street benzos returned as a Tizalan, and I think that was something that we were seeing across the country anyway. At that time the samples were coming mainly from Glasgow and the borders, because that was us just starting to... The Glasgow group, I should mention, has been in existence, it'll be almost 5 years soon, but the actual national project's only been up and running for 2.5 years, so we already had quite a good relationship with the guys in Glasgow, and then the borders was our next meeting, and so on. So you can see we more than doubled the samples that we took in 2023. However, we had quite a lot of them where results weren't returned, and that happens for a number of different reasons. Sometimes the full postcode isn't added, or the effects for them is incomplete, so there can be a number of reasons why the results don't get returned, and we have had some of them where they've just went missing in the mail. But you can see, again, for the 50 samples, quite a lot of them were street benzos, but this time we've seen a slight change. So we started to see more bromazepam and less atazolam, and we've seen that quite early in 2023. And this is when we had the Xanax that had out of the 7 Xanax that were sent away that year, 5 of them had bromazepam. So I think the key thing in this is you don't really know what's going to be in any of the drugs, is the key takeaway point. You might think you're buying one thing, it could be something totally different, and you can see there, by this time we now have the Fife group, East Ayrshire group, Lanarkshire group added to it. But you can see there's lots of other benzodiazepines there as well, even they're only making an appearance once. And I was just talking to Chris about this. So the gabapentinoids, we had a sample was sent away, it had no gabapentinoid in it whatsoever, it was just diazepam. So again, the same. We were just chatting about the actual marketing and the packaging that the gabapentin stuff comes in. It looks like pharmaceutical grade stuff, it's pretty good, the actual marketing and the trays and stuff like that, but you can see with that, with the content, there actually was no gabapentinoid in it whatsoever. And then this year, we're only halfway through it, but 20 odd samples away, quite a lot still waiting results. So if you use Wedinos on a regular basis, you will probably have noticed that there's a wee bit of a slowdown in getting the results back. You used to get them back almost like a week later, sometime 10 days, but there's been a wee bit of a slowdown, and I think some of that's maybe due to just the volume of stuff that's getting sent to them on a regular basis. And we were just checking the website on the way up there as well, and it looks like over the last month or two, like I've never seen so many that didn't produce results either, because the full postcode wasn't there, all the effects for them was incomplete. But for this, you can see that the street benzos, this year we've seen more bromazepam again. And it's really been good that we've been able to differentiate between the street benzos, because what normally happens is staff will talk to people just about benzos in general, and it's usually diazepam they refer to. So they might talk about the half-life being up to 100 hours and stuff, but it's been really good for us to be able to identify what benzos are actually in it, because then we've been able to tailor the harm reduction advice to people in terms of the bramazolam, the atazolam, and explain to people that they might have a quicker onset, the effects might be a lot stronger, they might last a bit less than some other benzos like your diazepam and stuff. So, but that's really helped change people's behaviours, because when you're able to provide people using substances with this information, if you can provide it in a manner that makes sense to them. So I will deliver this to some of the guys, and how I sell it to them, if you like, as I say. So see that atazolam, it could be 10 or 12 times the strength of diazepam. Do you know what that means for you? That means instead of taking 50 diazepam, you'll probably get the same effect if you just take 10. Oh, that'll not cost me as much money then. So if you're able to sell it to people in a way that they see a benefit in it, but also there's maybe this thought that it wouldn't matter what was in it, people will just take it anyway, and that's actually not what we see through the group. So people will, when you say to them, right, that sample you gave has had this in it, they'll say, alright, I'm going to start taking less of that then. So they'll tailor how they're taking the substance based on what you can tell them, and that's became really apparent with the nitazene testing, and we'll go into some of that. But you can see just the wee trends there for the benzos. So a whole load of different stuff showed up in the samples we've started, but predominantly atazolam and bramazolam. We see very few diazepam, very few street benzos actually come back with diazepam in them now. So I've got about 10 minutes, we'll just talk a wee bit about this, about the testing strips. So we started to pilot this about 2 months ago, and we already knew through the webinar stuff there was an appetite for people to test their drugs if you give them the opportunity. So we started by doing a wee demo, and what I should say is I've got some strips with me, and at the break and at lunch I'll do a few wee demos if anybody wants to just come and watch it, ask any questions just in where we get the tea and coffee. I'll be happy to do that. So we do a wee live demo with people. There's a very good nitazene testing strip video on YouTube. It comes, I've not got the strip on me, it comes for the Rapid Response testing strip company. It's about 2 minutes long. So we'll show them that, then we'll take any questions, and then we'll just do a wee live demo with people and talk them through the results. Now, one of the first things we noticed was there was a bit of confusion with the results. So people were familiar with the COVID testing, which was 2 lines was a positive. The nitazene testing, it's 1 line's a positive and 2's a negative. So the first couple of times we done it with groups, people said, oh, what drugs was that you tested, it's positive? It was just like a paracetamol. So we had to make sure that we started with all the groups talking to them and making sure that they were clear that 2 lines for the nitazenes is a negative, 1 line is a positive. But so as you can see there, in the last couple of months, over the almost all of our groups, we've trained 241 people, give out a whole load of harm reduction advice, gave quite a lot of strips out. You can see there 180 odd. At the moment, to date, we've only picked up three positives for these strips that we've gave out. One of the positives we got back, it was a false positive. We're still awaiting the results of the other 2, and the 3 samples that we picked up, the positives, 2 of them were street benzos and 1 was heroin. But as I mentioned earlier, What this has allowed us to do alongside the webinars is get real-time information for people. So you're no working 3 months behind the curve. As soon as something new hits the streets, people are telling you in the groups. And we're testing it for netizens and getting it in. Quite a lot of the cases they're able to bring a sample with them. Probably the challenge with the sample is a lot of times, if I'm honest, the guys and lasses that come to the group, you'll say, if you got a sample to send to webinars, they'll pull a big bag of Street Valium and you go, put them back in your pocket, we don't want to see them. But here's an envelope that will support you to send one away. So people are more than happy. But it's gave us a great opportunity, the netizen testing stuff, just to open up the conversations. Because I think I'm guilty of this myself. When you're dealing with people that have been around for a long time in the drug scene, 10, 20, 30 years, you can sometimes forget to go back and have the basic conversations with them, because you go, they know, oh, I've been talking to him for 10 years about this. But this has allowed us to go back in and have the conversations with people, find out what are they really using, what effects are they getting out of it, what's on the streets that we're not seeing yet, but that they have knowledge of, and being able to give them a whole load of different harm reduction information. And more importantly, there's some people in the room today that we've been able to link quite a lot of the guys and lasses coming to these groups into treatment or back into treatment because for whatever reasons they've just fell out of treatment, either because the service was no longer meeting their needs or something else might have happened, they went to prison or whatever and they came out and they just didn't go back. So it's been great in that sense. Also been able to just give them the proper information and a bit of training. People always appreciate that, and we know, because the guys and lasses come back and tell us at the groups, we know, like at Glasgow for talking sake, if we train the 12 or 16 that come there every week, or the 12 that come to Fife, or the 12 or plus that come to the borders, we know they go back into the community and they tell their peers. So you train 12 people in the borders, and probably within a week 50 people know about that information, and that's a brilliant way of actually getting proper information out to people. So the initial feedback for the training is people have considered changing their behaviour. So we doing this still, Kat and Stephen are still doing it on a weekly basis. When we do the netizen testing strips with them, we give people strips, we say to them, what are you going to do if it's positive? Some people come back and say, yeah, I wouldn't use it. Others will be a bit more open and say, I'm still using it, but I'll use a wee bit less. And then some people will say, I'll no change at all. I'll just continue to use whatever it is, how I've always used it. But it's allowed us to go back and make sure that people have naloxone, and they've got a couple of supplies of it, which is dead important. Because loads of people tell you they've got naloxone, but very few of them will be carrying it. So it's allowed us to sort of hammer home that message again. Listen, you need to carry this, it's dead important. And people are carrying it a bit more now that you have Nixoid, which is a lot smaller and more compact to put in your pocket. But my time's up, I've got a couple of minutes, but what we've realised is there's a real appetite within this community for drug checking, definitely. And I know there's a few licences in with the Home Office at the moment to look at getting drug checking services, and that's great, but I think we also need to be thinking about what might we be able to introduce similar to netizen testing strips that we can actually just give people information there and then. Because if we need the information just to change people's behaviour and give them a bit of harm reduction advice, we don't really need a deep dive into that drug. We just need to have an idea what's in it, on the front to be able to provide that. And I think if we had something like that available, I know there's lots of different products out there, I think people would jump at the chance. And this is a great way, when there's an appetite for drug checking, this is a great way of engaging people in the wider discussion around not only medication assisted treatment standards, residential rehab, the whole range of stuff that's out there for people. So I think we don't want to lose that momentum. At the end of the pilot, our plan is to write that up and share the results of that. And I know that there might be some people in the room today. I know there's a few other organisations who started this as well, and they've started to pick up some positive samples. So the more of this we can do, the better, and we might just be in with a chance in terms of the overdoses. We might be able to avert some of the fatal overdoses if we're proactive and we're able to make sure there's more naloxone and stuff like that. So obviously we're not doing the questions, but I'll just give a wee shout out to Katie, who's our programme manager, who manages the Living Experience team, the volunteer in peer research and the naloxone peer team. She wasn't able to make it here today, but she kindly put the slides and stuff together, and I'm happy to do the questions later with the panel. Thanks for listening.